Dear friends, welcome to the second session of this talk, Preparation for DNB Examinations in Radio Diagnosis. Dear friends, as if you have gone through our revised curriculum, the interventional procedures carry a lot of weightage, and taking not just the interventional procedures but the instruments and procedures combined together may come as part of the spots. They may come as part of the long cases, and they may come as part of the viva or table viva in the clinical examinations. We have with us Professor Chandramohan. He will take you through the various instruments which and introduce you to various procedures which can be of great use during the exams. Over to Dr. Mohan.
Good afternoon, everybody. Actually, I would like to stress here that after having gone through various practical examinations as an examiner, we have found that students probably are not fully aware what is expected of them as far as the practical exam components are concerned. It has various components, and I think when the student comes for a DNB exam, the examiners expect that they are fully aware of what material they have handled during last 3 years of their training, the equipment they have handled, and what are the side effects, some complications, the risk factors in dealing with these equipments are concerned. And of course, the benefit of these procedures and techniques or the instruments to the patients are concerned. They are also should be fully aware of all this. To just run through what is expected in practical exam from the students, I will just mention what are the various components of the practical exams are in a DNB practical examination at present we are following. First of all, the aim of today's next 45 minutes or so is to apprise the students about various essentials that form the practical examination, and we also would like to show some of these items which are kept in the practical exam. Not only showing you these items, the aim is that we will have a probably interactive discussion. In case there are some queries, we will try and answer these queries at the same session as far as the use of this material, the disadvantages and advantages are concerned. And lastly, we would also like to mention what is expected from the students as far as these items are concerned. So, just to mention the various components of the practical exam, we have spots first in the morning. Most of the centers are following a policy of keeping 40 spots in every examination. Each spot carries 2 marks, so total of 80 marks are devoted to spots. Spots form a very important ingredient of practical exam. Now, why spots are important? Because this is the first exposure of the student to the practical examination, and these spots actually tells us the spontaneous reaction of the student, how fast he can pick up the lesions and how his eyes are trained. Actually, one can make out the caliber or the training levels of the student from the spot.